Okay. All right. Thanks. The Finance and Planning Committee meeting of the Health Commission is now called to order.
Great, and I will take the roll. Commissioner Chung.
Present.
And Commissioner Chow.
Present.
All right, thank you. I will read the land acknowledgement. The San Francisco Health Commission acknowledges that we are on the unceded ancestral homeland of the Ramaytush Ohlone, who are the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land and in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community and by affirming their sovereign rights as First Peoples. All right, Commissioner, would you like me to call the items, or will you be doing that?
Would you mind doing that too, Mark?
Absolutely. Item 2 is the approval of the minutes of the March 1st, 2022 committee meeting.
I move approval.
And I second.
All right, thank you. I'll note there's no one on the public comment line, so I'll take those two actions as an action of the committee, and we can move on to item 3, which is the monthly contracts report.
Hi, good afternoon, commissioners and Mark. Okay, I'll just start at the top and go through them, and I have representatives here for each of the contracts for questions, and I've received some responses back that I'll weave into their from the questions that you sent, except not the first one. So I have Juan Ibarra here for that. But the first contract on the contracts report is Richmond Area Multi-Services, RAMS, which is our vocational services contract. And what we're requesting today is approval of a new agreement, but it's for the same ongoing vocational services. We did a solicitation and RAMS was selected again. And so they are continuing the same services. And so that's what you are seeing reflected here as a new contract for ongoing services. The program, it's authorized under the solicitation RFP 21/2020, and we're asking for an amount of $9,568,795. For future extensions, we'll bring it back here because it will be subject to approval by the Board of Supervisors. I think you had one question, which was, I'm guessing that it was because the unduplicated clients were NA from Higher Ability Janitorial Services and the clerical and mailroom services. You were wondering if there was UDC from the prior year, and I'll let Juan answer that if he researched it. I would assume it's just not tracked that way, but he can respond if he's on here.
There we go.
Hello, commissioners. This is Juan Ibarra. I'm the program manager for the vocational service programs at BHS. And I was able to get that information from fiscal year 2021 program reports that they submit each year. And so by program, I got the information. So there's different programs within the contract. Janitorial is one of them, and they provided services to 34 individuals. And the second program, TAY Vocational, they provided services to 14 individuals. And then the clerical program, they provided services to 32 individuals. And the other program, information technology, IT program, they provided services to 32 individuals.
And this is the previous year, is that correct?
Yeah, the previous fiscal year, 2021.
So, do we know, I know this may not be part of the question that that we give the contract off to, but how many of these then actually go on and are able to get a job?
So these individuals are not tracked for that. Those individuals that are express interest in obtaining employment, they're referred on to the Department of Rehabilitation, where we have a separate sort of arrangement. It's called the cooperative program. When they're with DOR, that's like one of their main goals to obtain employment. But I do have information on to get a sense of who completes these training programs. I have that information.
Oh, good. That would be helpful.
Yeah, so for example, for the janitorial program, they have an objective that 75% of participants who receive services for at least 3 months successfully complete the program. And sorry, I read the results. Let me read the objective. I apologize. The objective is written that 50% of applicable participants who receive services for at least 3 months will successfully complete the program, meaning that they will complete the internship duration or early departure due to employment or enrollment in education or another training internship program. And the result was that 75% of the individuals who received services for at least 3 months completed the program. That was the result.
Okay.
I can go on and share on other programs.
Sure.
For-
Just, there are only about 4 programs. So if you could just give us a sense as to the success that they've had.
Yeah, the K-Vote program, their goal was 75% of applicable participants would successfully complete the program. The results were that 100% of participants enrolled after 3 months of successfully participated, completed the program. And for the IT program, the goal was 75% of enrolled trainees would successfully complete the program, and their results were 83% enrolled trainees have successfully completed the program. And just as a quick reminder, this was in the middle of that pandemic too. So the clerical program, it's called the clerical and mailroom program. Their goal was 50% of participants who received services for at least 3 months would successfully complete, and the results were 57% of participants successfully completed the program.
Okay. Well, thank you.
You're welcome.
Any other questions or comments on this contract, commissioners?
I don't have any other.
I believe we can move on, Ms. Ruggles.
Hey, okay, so the next one is Fort Help Mission. What we're asking for today is an amendment with Fort Help Mission, which would increase the total contract amount with contingency up to an amount of 9.3 million. And then we would also be extending the contract through June 30th, 2027. So we're adding 5 years. You previously approved this contract when we first, as a result of the original solicitation in June 2017. And the contract provides, as part of the organized delivery system and opiate narcotic treatment that we often are part of it is the methadone treatment. And so it's just continuing the same service of what you originally approved, and we're exercising the options under the RFP that authorized the services in the first place. And if you have programmatic questions, I believe Dr. Martin is here.
Commissioners, any questions or comments on this?
I guess if Dr. Martin is here, perhaps we can just hear subjectively because a lot of the services have been rendered, but how successful, do you feel that the patients have been benefited?
Good afternoon. Thank you for asking. So I don't know specifically about this program. I know in general our opioid treatment programs as a composite, we have a performance objective of 70% 1-year retention. And the programs have met that year after year after year. So it's one of our many programs that we're proud of.
Okay.
Treatment programs.
No, thank you.
Especially now with all the overdoses, they become very important.
Yes, yes, no, and that's commendable. Thank you very much.
I believe we can move forward, Ms. Ruggles. Thank you, Dr. Martin.
Thanks. Okay. The next contract is Seneca Center, and here for this contract, we're requesting approval of a contract amendment to extend this contract by 5 years, bringing it up to a total of 10.5 years, and increasing the contract amount as well. And then we're taking this to the Board of Supervisors. The one change that you'll notice in this contract is there's a big decrease from this year to next year, and that's because some of the programs that we've listed are subject to be resolicited. The RFP 33/2016 expires, and that impacts long-term connections, intensive therapeutic foster care, and their COMPASS program. So those won't continue under this contract. And we have the solicitation is in motion. And so if Seneca is successful, they'll have a new standalone contract. And I think you had a question about they didn't meet their client satisfaction survey requirements, and they also didn't have a plan of correction. I've lost my notes. And so you were wondering if there were any comments on that. And I did check with Tom Mesa, who's the director of the Business Office of Contract Compliance. And so really what it's related to is COVID, not age related or any other reason, or it's believed to be related to COVID, because it was hard to have clients complete the satisfaction surveys while people were working remotely under the difficulties of COVID. And so as a result of that, this the understanding of how difficult it was. There wasn't a plan of action attached to it because it seemed very COVID related. So that's why. And I believe we have the System of Care Program Manager here for this program if you have any other questions.
Well, thank you. I appreciate the answer, and I guess we would look forward to better response. At first, I had thought maybe it was really difficult working with this population, but it would be useful, of course, in the future to get their response again.
Right. Okay, shall I move on? Is that fine?
Please do.
Okay. So the next contract is Curry Senior Center, and it's our Mental Health Services Act contract with them. This is also an amendment, and we are here requesting an extension by 1 year, which is the last option available under this solicitation. So this will make this contract 5 years. And they provide outreach and engagement services to socially isolated older adults with mental health concerns living in the central neighborhoods of San Francisco. And I believe the program representative is here if you have any staff or programmatic questions.
Commissioners, any questions or comments?
I guess it would be useful, since we have a moment or two here, to again get sort of an objective feeling from the program manager as to how successful we've been. Obviously, volume-wise, there are about 320 people under this, but what behavioral changes would one have expected, and how well did we do with those 320?
Sure. Yes, this program we feel has been very impactful. It was actually started as one of our MHSA innovation programs, which includes a very large evaluation component. And they worked with an evaluator from UCSF and used evidence-based measures to measure social isolation within older adults and show that there was an improvement in lessening their feelings of isolation and increasing their feelings of wellness. So we believe this is has been a very successful program, which involves peer-based services, peers going and doing one-on-one outreach and support of older adults who are in very isolated settings such as SROs, including in the Tenderloin area.
So I think you mentioned this sounded like it was a pilot that was successful. Are we intending to expand that type of program under Mental Health SF?
Yes, it's been expanded already. It started as a 5-year pilot under our innovation funding, and it's been continued after community feedback and reviewing the evaluation results as a core program funded by community services and support funding.
Very good. Thank you. I don't have any other questions on this contract.
Thank you.
Great. Commissioner Chong, any from you?
No, I'm pretty familiar with most of these programs, so I don't have a whole lot of questions.
All right, thank you. Ms. Ruggles, we can move on then.
Okay. The next contract is an amendment also. This is for Felton Institute, also known as Family Service Agency, and this is specific to their Beam Up and TAY linkage program. So what we're requesting here is the approval of a contract amendment for these programs, and we would be adding funding and extending the term through June 30th, 2024. What you noticed in your questions is that the funding is going down, and that is because it reflects the change in the grant funding. And so Heather Weisbrod, I believe, is here, and she also provided some response, but Heather, do you want to respond to the question?
Sure, I can respond to it. Good afternoon, commissioners. We have 2 grants under this contract, one for the Beam Up program, early psychosis intervention, and the other for the TAY acute linkage program. In anticipation of the Beam Up contract or the Beam Up grant ending in September, we had previously applied for a state grant for early psychosis intervention, which we received. It has been implemented. It's folded under the other larger Felton grant under their PrEP program. But the intention behind that was to be able to continue the kinds of services and the intervention that is being provided under this Beam Up grant. So there'll be no loss of services to their current clients, and it will, in fact, be able to expand the number of clients that they're currently serving overall. The TAY acute linkage program grant is also ending. It's a program that we really believe in and has had a lot of success and is really important for our overall system. So we are identifying additional funding to be able to continue that program, again, with the hope of not reducing the number of clients that they're able to serve. So we have identified some SANSA grant funding that we'll be able to continue some funding for that program, and then anticipate that some of the Prop C take care coordination funding will also go to the TAY acute linkage program to be able to continue that program.
Thank you. And I have no further questions on that. I appreciate the fact that we're going to be trying to continue service to these people, and that sounds hopeful. Thanks.
Thank you, Commissioner. So we can move on. Ms. Ruggles. Thanks, Heather.
The next contract is Haluna Health. And this is a new contract, but it's continuing services. And the reason so the requested action is the approval of a new COVID task force contract with Haluna Health, and that we would have through June 30th, 2023. It was initially started as part of the health emergency. And so for that reason, it has been created as a new contract to continue the service. One of your questions was how many staff are supported, and Alice Corniati is the representative for this contract. And I think I see her here, and I'll just answer this. And then if you have further questions, she's here, but she reported that there's 16 staff members through June 30th, 2022. And then there'll be 13 staff members through June 30th, 2023.
Okay, thank you for the response. And obviously, this is really a necessary coordination. So I was just curious about how many people we were needing in order to help carry this on. So thank you.
So the next contract is the Asian and Pacific Islander Wellness Center, San Francisco Community Health Center, and I was requested today to continue it because there's still movement on the funding amount. And so I think because there's going to be changes, the amount of funding that you'll be requested to approve is going to be less. So we're going to just redo it and bring it back in May. So that one is done.
So are you saying we're not voting on this one today?
You're not voting on it today.
Okay. All right.
We'll be sure to note that in the full commission meeting. So we can move on to the Public Health Foundation contract.
Okay, so this is an amendment with the San Francisco Public Health Foundation, who manages subcontractors and consultants for us related to tobacco prevention and reduction in San Francisco. So this is an ongoing contract that we are extending from June 30th, 2022 to expiring to June 30th, 2025. And the Public Health Foundation receives a 10% administrative fee, which is $53,777, with the rest of the funding going towards the support of the programmatic activities directly. That's the main piece of that.
So my curiosity was that this is certainly a reasonable amount, but why would this not have been done in-house? That is the management, because that's not really, I mean, is it not effective in-house, or we don't have the capacity, or not that they're not doing a good job, but the point is that it's not a lot of money, so there can't be a lot of staff involved.
Well, there's a lot of subcontractors involved. So, or there are subcontractors involved. But you know what? I realized that, I don't know, Tracy Packer, are you here?
Yes, I'm here.
Yeah, you may not have been expecting this one, but you're able to answer this one.
Michelle, I'm here too, Patricia.
Oh, hi, Patricia.
If you'd
Okay.
like me to answer.
I got confused about, I get mixed up.
Dr. Chow, this is the services provided, the subcontractors that are engaged with are smaller CBOs that work directly with the community and often don't have the capacity to enter into contracts with DPH. And the Public Health Foundation also provides some supportive services around, capacity building and technical assistance to build their capacity.
That's fine. I'm pleased with that answer. I think that's a type of service we understand, and also allows these smaller organizations without having to build up their own structure to participate. So thank you very much for that explanation. I didn't have any other questions unless Chairman Chung had.
I don't.
So I believe we can move on to the last contract.
Okay, thanks. All right, so the last contract is with UCSF, the Regents of the University of California, SF. And what we're asking for today is an amendment for this contract, this existing contract, to extend the term by 2 years and to add the corresponding funding. This contract provides support for the expansion of clinical sexually transmitted disease and rapid and retention coordination services. This is a sole source contract, and the additional funding is being used, will be used to continue to expand the support for getting to zero modality. One of the questions that you asked was, the funding changes describes both a one-time carry forward of $95,000 and followed by a decrease of $95,054. And Tracy's here also, but I'll just tell you what she told me. So the $95,000 was taken out. The $95,000 was added as one-time carry forward dollars. And since it was one time, it was removed in the subsequent year.
Oh,
So
okay, all right. As it was written, it was a little strange that we were putting in 95,000 and then taking out 95,000. But I realized as a multi-year contract, you're saying the first year will have the extra 95,000, but the remaining does not. Is that right?
that's right. And then I think I cut and paste my notes badly, but oh no, there it is. Okay, so then you asked about the units of service. And so I guess Tracy could, or Patricia might be better to speak to this, but the units of service is a test, one test, screenings of their choice or all. So gonorrhea, chlamydia, syphilis. There's 27 tests per week, for about 48 weeks times 97% level of effort. So that is 1,257 STI tests, and then 297 hours of results disclosure and linkage to treatment is the other measure used in this contract. And so the total units of service delivered is 1,554.
Okay, no, thank you. Yeah, I don't have any other questions on that unless Commissioner Chung did.
No question.
So commissioners, I believe we're at a point where you all could consider a motion to put this on the consent calendar and recommend the full commission approve the whole report, except for that one contract that is not going forward.
Right, so I would motion that we do submit this to the commission for their approval, except for the API wellness contract.
And I'll second that, and we'll add that to the consent calendar for the commission's approval.
Thank you, and thank you all of staff who came and helped clarify each of the contracts. Item 4 is a request for approval of a new contract with City Health and Medical Corporation to perform COVID testing services.
Okay, naturally, I don't have it open. So I know that I believe it's Jenny and Kelly Hiramoto. I'm sorry, I was going to introduce it for you, but I didn't have it up. So if you want to just go ahead, I'll turn it right over to you to introduce the item. Oh, you're on mute, Jenny.
Yes, I'm on mute. Thank you. Sure. This is a City Health contract that is a new vendor. We have an existing vendor now, but it currently does not meet our existing capacity needs. So the City Health contract would complement the testing services we offer, which is in the form of mobile testing, and that allows for more flexibility of moving the testing sites to where the needs are. And Michelle, do you have the total amount in front of you for approval?
No. Yeah, hang on, I'll get it.
It's $7,447,440.
Thank you.
And so I guess the question first, have we been doing business with City Health in the past and not have problems with them?
They have been providing testing at the Treasure Island site. And they've been doing that since mid last year, and we have not had any issues with them. And they have a history of being in the last Omicron surge. And I believe the document shares the other areas that they provide testing outside of San Francisco.
If I may, Commissioner Chow, we also, they helped bail us out to do jail testing during height of surge during the Delta outbreak. And so they've been good partners with us to get us through the tough spots during COVID surge times.
Ah, okay.
This is Kelly Hermoto, Special Projects Manager with the department. Sorry, out of practice.
Well, it's nice to have an organization that actually is in Northern California. So we seem to be dealing with big national companies and once in a while having, or running into their capacity issues, right? So, and this is as needed contract, right?
It's actually a contract, Commissioner Chow, to provide mobile services. And so it'll be doing community testing at fixed sites through this next transitional phase of responding to COVID.
Right. No, I meant it's related to as many sites that you might need up to this amount, right?
That's correct.
Yeah, that's what I meant. Okay. No, thank you. So I don't have any other questions on this new contract. I don't know if Commissioner Chung did.
I don't.
There's no public comment on this, Commissioner, so all we need at this point is a motion and a second for approval.
I would move that we recommend this to the commission for approval.
And I will second, and we'll add this new contract to the consent calendar for approval by the commission.
Great, thank you, Jenny and Kelly.
Thank you, Commissioners. Thank you, Mark.
We can move on to item 5, emerging issues. Anything, Commissioners? Okay.
What happened to the last emerging issue that Commissioner Chung spoke about? I'm just wondering what we're doing with emerging issues. That's all. This one is sort of, an interest to make sure, how GPH staff is dealing with the current war situation, right? So I thought we should at least try to see if are we doing a follow up, or was there some sort of important, how maybe it's not affecting our staff right here at the contracts office.
I did not follow up on that. I thought that was more of a statement of support, but I will check in with Director Colfax and Dr. Baba, and I can let the commissioners know if there have been issues and how the department is supporting staff who may be impacted. So I apologize.
Yeah, it might actually also be a better discussion item for the whole commission meetings, because I think that, like some of our staffs do get impacted, and because we have so many things happening in the last 3 years, I think that we should do some type of reflections to make sure that, we're doing our best to provide the support that everybody needs.
Thank you. Commissioner Chung, would you like me to prompt you to mention that in the full commission meeting today under, it's not on emerging issues there, but another topic, or just follow through with Commissioner Bernal at a later time to maybe schedule it for something?
Either way is fine with me, really.
Okay, great. Well,
Yeah, maybe Commissioner Chung would just mention that this is something that we wanted to raise to be sure that the entire department, not just contracts, was getting support from, the devastation occurring over in Ukraine.
Yeah, and I think that it's just so much stressors that we are experiencing collectively. So it would be ridiculous to say that nobody's affected, but in terms of the impact, I think that we should try to evaluate that as well.
Thank you. Thank you, Commissioner Chow, for the nudge, and Commissioner Chung, I will follow through. And again, depending on what happens in the full commission meeting, the length and what else is happening, I will prompt you to say something today, and then we'll definitely figure out a way to follow through.
Great.
And we'll move on to item 6, public comment, and there is no one on the line. So I believe we're now at a consideration for adjournment, commissioners.
I would move for adjournment.
And I'll second. So thanks again for all the participations, and the meeting is now adjourned, and we have over an hour break. Yay.
Thank you, everyone.